Since it was founded in 1922, the American Society for Clinical Pathology has grown to become a global leader in laboratory medicine. ASCP is proud of its distinction as the world's largest professional membership organization for pathologists and laboratory professionals. The Society's commitment to the professionals that make up this community has cemented ASCP as an industry leader. In 1928, ASCP became the first professional medicine organization to set standards for laboratory professionals. Initially established as the Board of Registry, it was the first certification agency for laboratory personnel. Today, the Board of Registry is now known as the ASCP Board of Certification and has over 1 million certificates. In 1931, ASCP published the first compilation of standardized laboratory techniques. 12 years after it was founded, this dynamic professional community established a committee that would ultimately become responsible for establishing the American Board of Pathology with a mission of determining standards for the certification of pathologists. Amidst the backdrop of post-war economic recovery in 1931, ASCP once again made strides in developing its community of certified pathologists by creating new resources to enhance publishing of the first American Journal for Clinical Pathologists and the creation of the College of American Pathologists. The momentum continued for ASCP, and 10 years later, in 1956, the Society presented the first continuing education programs at its spring meeting in St. Louis, Missouri. The focus of providing premier, continuing medical education for the members was evident when in 1971, ASCP became the first of such healthcare communities to introduce a self-assessment program for pathologists. This focus continued into the 1980s when ASCP became the first organization to develop guidelines for the approval of continuing medical history education programs. Additional triumphant milestones were celebrated when in 1983, ASCP became the first pathology organization to develop and implement the Residence in Service exam, also known as RISE, an assessment tool for pathology residents. Just 2 years later, in 1985, ASCP celebrated another medical laboratory community milestone in becoming the first organization to develop guidelines for the approval of continuing medical laboratory education, otherwise known as CMLE programs. In the 1990s, the Society began awarding annual $1,000 ASCP scholarships to 50 medical laboratory students. ASCP's momentum soared into the millennium. However, the best was yet to come. From the very beginning, the American Society for Clinical Pathology's 4 core values have been the quintessential force behind the worldwide community that it serves. ASCP understands its role as a key resource to pathologists and lab professionals amidst the rapidly changing climate of the healthcare industry. Each year, the Society hosts its annual meeting, which is the largest global assembly of pathology and laboratory medicine, with the greatest number of hours of continuing medical education. Also, at these meetings, ASCP has enlisted global change agents such as Bill Clinton, Hillary Clinton, Barbara and Laura Bush, and Dr. Paul Farmer. These advocates and patient ambassadors trumpet the ongoing journey to expansion and of improvement of patient care worldwide through expansion of medical laboratory systems, with the opportunities for rich, customizable learning experiences. Laboratory professionals and the ASCP member community is also responding heartily to ASCP's unlimited online continuing education offerings, such as Remember, featuring flexible on-demand solutions for meeting credential maintenance program, CMP, and maintenance of certification, MOC requirements. ASCP reports a 70% increase in the number of U.S. certificates since 2006, expanding to applicants in 93 countries since 2006. Today, the ASCP Board of Certification proudly offers certification across 18 categories and has more than 500,000 certificates. The Society is committed to the advancement of the entire pathology and laboratory medicine community and works tirelessly to incorporate higher laboratory standards and best practices, ensuring quality care for patients across the globe. To raise awareness of the profession and inspire development for the next generation of leaders, ASCP strives to secure adequate funding and financial reimbursement for the pathology and laboratory medicine community, championing these causes in funding numerous scholarships and grants. ASCP has been a leader in developing advancement programs for the next generation of leaders, such as Lab Management University. Throughout the past decade, ASCP has advocated for patient-centric public policy. ASCP is proud to serve as a voice for its laboratory medical professionals and the global community of patients that they serve. ASCP is committed to actively creating strategic alliances for the benefit of our members and the global communities that they serve. These alliances include formal partnerships with myriad medical societies, such as the United States and Canadian Academy of Pathology, as well as governmental agencies such as Centers for Disease Control and Prevention, and the White House through an announcement, an ASCP-led coalition to diagnose and treat cancer throughout Africa. Improving global health requires the development of a strong community to ensure the quality of the practice of laboratory medicine around the world. ASCP is broadcasting our educational and humanitarian efforts to build a sustainable laboratory infrastructure worldwide. ASCP is committed to improving global health by exploring, identifying, and implementing innovative methods and partnerships that improve laboratory practices. We are now leading the way in utilizing technology to provide rapid cancer diagnosis, care, and treatment to underserved areas in sub-Saharan Africa. We continue to expand our global footprint and impact on patient care worldwide on behalf of patients, pathologists, and laboratory professionals to improve patient care across the globe. For almost a century, the American Society for Clinical Pathology has led the effort to support the momentous work and tireless efforts of the clinical pathology community's role in establishing a healthier world. The work of our founding members continues on stronger than ever. In fact, the past 10 years represent a decade of uniting and aligning the dynamic caring community of more than 100,000 anatomic and clinical pathologists, residents, and fellows, medical laboratory professionals, and students with the common goal of improving patient care through knowledge, advancement, collaboration, and the expanding global community. Tremendous strides have been made in expanding the community and the impact of its work. Thanks to the leadership and sacrifices of these pioneering forces, our society has made unprecedented headway in the fight against some of the most powerful maladies that have plagued modern mankind, daring to extend medical care and proper treatment to patients and communities across the globe. ASCP began as a hopeful journey by 39 physicians and has become an inspiring movement with 100,000 members, impacting lives, communities, the profession, and the entire medical industry, harnessing ongoing technical innovation, developing partnerships, and expanding our global presence. We continue to grow together. We work together. We learn together. We move forward together. We are stronger together.